careful. This sleeping position could silently steal your life away. Sleep, a precious gift for the body to recover, sometimes hides dangerous threats, especially for the elderly. It's not just about back pain or sore knees. An improper sleeping posture can compress the cardiovascular system, reduce oxygen flow to the brain, and even lead to sudden death without warning. What's truly alarming is that many people are unknowingly putting themselves at risk every night. In today's video, we'll uncover which sleeping position is silently threatening the health of older adults. Why can a seemingly small bedtime habit become a matter of life and death? And what are the best sleeping postures to naturally and sustainably protect your health and extend your lifespan? Before we dive in, leave a positive affirmation in the comments below, like, "I take care of my sleep every day," as a commitment to safeguarding your own health and that of your loved ones. And don't forget to like this video and subscribe to our channel so you won't miss any valuable knowledge about senior health. Let's build a community where we live well, live joyfully, and treasure every moment. Before we begin, it's important to understand why just one wrong sleeping position can put your life at risk. When we're young, our bodies can naturally adjust and recover, even after hours of sleeping in an awkward position. However, for the elderly, it's a different story. The natural aging process brings subtle changes in the cardiovascular, respiratory, nervous, and musculoskeletal systems, making proper sleeping posture not just a matter of comfort, but a critical necessity for survival. As time goes by, blood circulation weakens, blood vessels lose their elasticity, and the heart must work harder to pump blood throughout the body. Meanwhile, the respiratory system also becomes less efficient at exchanging gases, limiting the oxygen supply to the brain and other vital organs. Adding to the problem, the nervous system, which regulates heart rate, blood pressure, and breathing during sleep, gradually loses its responsiveness, reducing the body's ability to react to unexpected changes in posture or biological rhythms. At this stage, a correct or incorrect sleeping position doesn't just affect comfort, it can directly impact survival. An improper sleeping position can increase pressure on the heart and lungs, hinder blood flow, and cause a serious drop in oxygen levels reaching the brain. When the brain is deprived of oxygen for too long, the risk of stroke, heart attack, or even sudden death during sleep rises sharply. Especially dangerous are postures that compress the chest or overbend the neck, obstructing the airway and reducing lung ventilation. This explains why many elderly individuals experience shortness of breath, chest pain, or even stop breathing altogether during sleep, often without their families noticing in time. On top of that, poor sleeping posture worsens existing musculoskeletal issues which are common in older adults. The spine, shoulders, and hips are already weakened, and prolonged pressure on these areas can lead to chronic pain and impaired mobility upon waking. Elderly people might wake up feeling stiff, sore, and unable to stand or walk, normally increasing the risk of falls, fractures, and other dangerous complications. And as promised, now I'll reveal the dangerous sleeping positions you must avoid immediately. First, sleeping on your stomach. Among all common sleeping positions, sleeping on the stomach might seem like it only causes backaches or stiff necks. But in reality, it's one of the most dangerous positions for older adults and could silently lead to sudden death during sleep. When you sleep on your stomach, your entire body weight presses down on your chest and abdomen. This directly compresses the heart and lungs, two vital organs responsible for maintaining stable breathing and blood circulation throughout the night. Young, healthy bodies might still adapt and change position if discomfort arises. But for seniors whose respiratory and cardiovascular systems are already weakened, prolonged stomach sleeping becomes an unbearable burden. Pressure on the chest restricts lung expansion, preventing the lungs from fully filling with oxygen and properly expelling carbon dioxide. When blood oxygen levels drop below a safe threshold, brain, heart, and other vital organ cells begin to suffer from oxygen deprivation. This is the silent mechanism that can lead to arrhythmias, heart attacks, or strokes while sleeping. Moreover, sleeping on your stomach compresses major blood vessels in the chest and abdomen, disrupting blood flow back to the heart. blood can pool in the extremities, while the brain is deprived of fresh oxygen-rich blood. In some cases, prolonged oxygen deficiency, combined with cardiac arrhythmias, can trigger acute heart failure, resulting in sudden death during sleep. Multiple medical studies have shown that sleeping on the stomach significantly increases the risk of death during sleep, especially among individuals with pre-existing conditions like heart failure, chronic obstructive pulmonary disease, hypertension, diabetes, and particularly among seniors. For those with a history of stroke or cerebrovascular accidents, sleeping on the stomach doubles the risk of a recurrent stroke. Additionally, this position negatively impacts the musculoskeletal system. Sleeping on your stomach forces the neck to twist to one side for breathing, leading to prolonged stiffness in the neck and shoulders. Overnight, this can cause pain, muscle spasms, or even cervical spine damage, increasing the risk of falls and balance loss upon waking in older adults. Even more dangerously, seniors often experience deeper sleep and have reduced reflexes for adjusting their position. This means they may remain in a harmful posture for hours without recognizing critical warning signs like difficulty breathing or chest pain. Second, improper semi-reclining position. As we age, our bodies naturally undergo changes. The cardiovascular system weakens, respiratory function declines, and muscles and joints lose flexibility. This means that even a small change in sleeping posture can have serious consequences, and in some cases threaten one's life. Sleeping in a semi-reclined position, if not properly supported, can create a series of very dangerous effects. First, when the upper body is overly bent forward, it compresses the chest cavity, reducing lung capacity. The lungs can't fully expand to absorb the necessary amount of oxygen into the blood. When blood oxygen levels drop, vital organs like the heart, brain, liver, and kidneys suffer from oxygen deprivation, leading to impaired function. Especially in the elderly, the brain is extremely sensitive to oxygen shortage. Just a few minutes of insufficient oxygen can cause severe damage, significantly increasing the risk of stroke or sudden loss of consciousness during sleep. Second, this hunched position hinders the blood flow returning to the heart. When blood circulation is obstructed, the heart must work harder to pump blood throughout the body. This extra strain on the heart is particularly dangerous for those with existing conditions like heart failure, hypertension, or atherosclerosis. If the heart becomes overwhelmed, it can trigger arrhythmias, sudden heart failure, or a heart attack right during sleep. Third, an incorrect semi-reclining posture can interfere with diaphragm function, a crucial muscle for breathing. When the diaphragm is compressed, the ability to take deep breaths is reduced, and older adults can easily fall into a pattern of shallow breathing. Prolonged shallow breathing at night raises the risk of sleep apnea, one of the leading causes of sudden death during sleep among seniors. Moreover, this unstable position also increases the risk of blood clots due to slowed blood circulation. If a clot travels to the brain or heart, it could cause a stroke or an acute heart attack, both of which carry extremely high fatality rates if not treated promptly. Third, dozing off while sitting. It's a familiar sight. Older adults dozing off in a chair at the table or while watching TV. At first glance, it seems harmless, maybe even a little relaxing. However, few people realize that napping in a sitting position, especially for extended periods without changing posture, carries serious hidden risks, including strokes or sudden death. When elderly people fall asleep, sitting up their heads often droop forward, creating an abnormal bend between the neck and the upper body. This bend can compress major neck arteries, like the carotid arteries, the main vessels delivering blood from the heart to the brain. When these arteries are compressed, blood flow to the brain drops significantly. Since the brain is extremely sensitive to any shortage of oxygen and nutrients, it can quickly suffer damage, leading to severe complications like a stroke, sudden fainting, or even death. Additionally, sleeping while seated slows down overall blood circulation. Gravity causes blood to pool in the lower limbs, leading to congestion in the arms and legs. Meanwhile, because there's little muscle movement during a nap, the muscles aren't helping to pump blood back to the heart, raising the risk of blood clot formation. If a clot moves to the brain or heart, it can trigger a deadly stroke or heart attack without any warning. On top of that, a hunched sitting position restricts lung function. When the lungs can't fully expand, the amount of oxygen absorbed into the body drops sharply. Prolonged oxygen deficiency during sleep not only causes fatigue and dizziness upon waking, but also places extra strain on the heart, leads to arrhythmias, and gradually weakens respiratory function. Fourth, twisted, unnatural sleeping positions. During sleep, many people unconsciously maintain awkward postures, like the neck twisted sharply to one side, the chest misaligned with the body's axis, or the entire body contorted unevenly. For young people with flexible bodies and strong circulation, these positions might just cause mild soreness after waking up. But for older adults, twisted sleeping postures can have serious, even life-threatening consequences. Normally, major blood vessels, especially the carotid and vertebral arteries in the neck, ensure that oxygen-rich blood flows steadily from the heart to nourish the brain. However, when the neck is excessively twisted or remains tilted for a long time during sleep, these arteries can become compressed, restricting or even blocking blood flow. This disruption of blood flow to the brain is extremely dangerous. The brain is the most sensitive organ when it comes to oxygen deprivation. Even just a few minutes of interrupted blood circulation can begin to cause damage to brain cells, significantly increasing the risk of transient ischemic attacks, brief episodes where the brain temporarily lacks sufficient blood supply, or even leading to full-blown strokes. For older adults who often already struggle with conditions such as hardening of the arteries, narrowing of the carotid arteries, or other cerebrovascular diseases, the level of danger becomes even more severe. Furthermore, twisted positions put abnormal pressure on the chest, interfering with natural breathing. When the chest is misaligned and the diaphragm can't function properly, the lungs can't fully expand, leading to reduced oxygen intake during sleep. This worsens brain oxygen deprivation and forces the heart to work harder to compensate for the oxygen shortage, putting enormous strain on an already vulnerable heart. Now that we've covered the dangerous sleeping positions, let's move on to the safe and health-promoting sleeping positions you should adopt. First, sleeping on your left side. First of all, sleeping on your left side helps reduce acid reflux, a very common issue among the elderly. When you sleep on your left, the natural position of the stomach and esophagus creates a favorable angle. The stomach sits lower than the esophagus, allowing gravity to help keep stomach acids and food from backing up into the throat. This significantly reduces symptoms like heartburn, chest discomfort, or that choking feeling at night. This benefit is especially important for those suffering from GERD, gastroesophageal reflux disease, a condition that can lead to chronic sore throat aspiration, pneumonia, and even esophageal cancer if left untreated. Secondly, sleeping on the left side supports better blood circulation and reduces strain on the heart. By leaning to the left, the weight of the internal organs doesn't press heavily on the heart, making it easier for the heart to pump blood without overexertion. This helps maintain stable blood pressure, reduces the risk of heart failure, arrhythmias, and other cardiovascular complications, dangers that naturally increase with aging. In addition, research has shown that left-side sleeping enhances lymphatic function, the body's waste clearing system. Since the majority of the lymphatic system is located on the left side, this position helps facilitate lymphatic drainage, making it easier for the body to detoxify while sleeping. This is a particularly valuable benefit for seniors whose natural detoxification ability has started to decline. Not only that, for people suffering from sleep apnea, sleeping on the left side can help keep the airway open, reduce airway blockages, and lower the risk of interrupted breathing at night, a crucial factor in preventing dangerous events like strokes or heart attacks during sleep. Second, sleeping flat on your back properly. As part of the natural aging process, the spine becomes weaker and vertebrae and discs lose elasticity. These gradual changes make maintaining the correct sleeping posture absolutely critical. Among them, lying flat on your back, if done correctly, is considered a simple yet highly effective method to protect the spine, reduce back pain, and support healthy breathing during sleep. When you sleep on your back, your body weight is evenly distributed across the bed surface. This helps the spine maintain its natural curvature without bending or twisting. The natural alignment from the neck through the back down to the hips reduces pressure on the vertebrae and allows the surrounding muscles to fully relax. This is why people who consistently sleep correctly on their backs often wake up without back pain or stiffness. Moreover, back sleeping is particularly beneficial for the respiratory system. When the body is straight and the face is facing upwards, the chest has ample space to expand fully. The diaphragm, the main muscle involved in breathing, can work more efficiently, supporting deep breaths and maximizing oxygen intake. For seniors, maintaining steady oxygen levels during sleep is crucial to prevent brain hypoxia, memory loss, and to ensure the heart functions optimally throughout the night. However, to achieve these benefits, proper back sleeping technique is essential. Older adults should use a pillow of moderate height, just enough to support the head and neck, so they align naturally with the back. Placing a small pillow under the knees is also highly recommended. This gently elevates the legs, reduces pressure on the lower back, and helps maintain the spine's natural curve. Third, gentle fetal position. Among the common sleeping postures, the fetal position, lying on your side with knees slightly drawn up towards the chest, has long been a favorite because it provides a sense of safety and warmth. For seniors, when done correctly, this posture offers surprising health benefits, especially in reducing snoring and supporting respiratory function. However, just like any habit, adopting the fetal position must be done scientifically to avoid negative effects. A gentle fetal position helps naturally expand the chest cavity, making it much easier for the lungs to fill with air and for the airways to remain clear and unobstructed during sleep. When the body is curled slightly to one side, the tongue is less likely to collapse backward, a major contributor to snoring and airway blockage during the night. As a result, airflow in and out of the lungs becomes smoother and more consistent, significantly decreasing snoring sounds and promoting better, deeper sleep quality overall. This is especially important for seniors who are more vulnerable to conditions like sleep apnea. Maintaining a gentle fetal position can help stabilize oxygen levels throughout the night, ensuring that vital organs such as the heart and brain receive a continuous and sufficient supply of oxygen and nutrients for optimal functioning. Additionally, sleeping in a relaxed fetal position can ease the pressure exerted on internal organs within the abdominal and chest cavities. By relieving this pressure, the digestive system can work more efficiently overnight, minimizing discomfort from bloating, gas, or indigestion, all common problems that elderly individuals often experience after evening meals. A more relaxed digestive process not only improves comfort, but also contributes to a more restful, uninterrupted night's sleep, helping older adults wake up feeling refreshed and more energized. Sleep may seem simple, but for older adults, it becomes a delicate journey that demands proper care from each breath to every sleeping position. A small misstep in how we place our bodies at night could silently lead to unexpected consequences, from chronic aches and pains to serious life-threatening events. While we can't stop the aging process, we absolutely can choose how we live, making our senior years lighter, healthier, and more peaceful. And it all starts with the smallest actions, like how we lie down on the bed each night, which can bring about tremendous changes for the journey ahead. Before we wrap up, let's take a moment to affirm something positive for ourselves. I choose to protect my health and cherish every good night's sleep. And don't forget to like this video and subscribe to the channel so we can continue walking together on the path toward a healthy, happy, and meaningful old age. Wishing you deep, restful sleep, and may every sunrise you wake up to be a precious gift for your life.